This is the pharmacology review for all of the different medications that we've talked about throughout the upper respiratory lecture. First, we have analgesics. This will help to decrease pain, inflammation, and fever by blocking prostaglandins. Examples of these are aspirin and Tylenol. One of the side effects of aspirin is an increased bleeding time. So because of this, we do not want to give aspirin to our patients who have GI bleeds or who have any other type of bleeding disorder. With Tylenol, we want to pay attention to liver disease because Tylenol is contraindicated in patients with liver disease. In this lecture, we have talked about using analgesics in the treatment of flu, nosebleeds, sinusitis, and acute pharyngitis. The question on this slide is, why would acetaminophen be used for a nosebleed instead of aspirin? This goes back to bleeding. We just talked about how a side effect of aspirin is increased bleeding time, so we wouldn't want to give aspirin with an active bleed or with a problem where we are worried about bleeding. In this case, or in the case of a nosebleed, acetaminophen can help with the pain and discomfort without increasing bleeding time. Next is antibiotics. Antibiotics are used to kill bacteria. Something to note about antibiotics is that they kill both good and bad bacteria. Because of this, sometimes patients can experience diarrhea or C. diff from killing both the good and bad bacteria in the gut. So oftentimes, a probiotic will be used in the treatment of a patient with antibiotics. The timing here is very important because you don't want to give an antibiotic at the same time as a probiotic because the antibiotic will kill the good bacteria from the probiotic. So what we want to do here is give the probiotic 2 hours after we give the patient their antibiotic. We also want to consider the use of antacids because antacids can affect how antibiotics work. So we want to give antacids either an hour before or 2 hours after we give the patient their antibiotic. In this lecture, we have talked about antibiotics in the use of treatment for bacterial sinusitis and bacterial pharyngitis. Next is anticholinergic nasal spray. This reduces nasal secretions by blocking cholinergic receptors. The most common side effect that we worry about is nasal dryness. This patient won't have other systemic side effects that we would normally see with PO anticholinergics because this is a nasal spray and it's localized to that area. We have talked about this in the use of treatment for allergic rhinitis. Antifungals. These are used in the treatment of fungosinusitis and fungopharyngitis. We also want to consider antacids with the use of these because antacids can alter how these antifungals work. We want to give these antifungals either 1 hour before or 2 hours after antacids. When you look at the list of antifungal medications on this slide, you do see that they have a common ending of azole. We will use these azole medications for sinusitis. For pharyngitis, we will use nystatin, which was the combination antifungal and antibiotic. That was the medication where we educate the patient to swish the medication around their mouth for as long as they can and then swallow. Antihistamines. These will treat inflammation by blocking histamine release. Remember, histamines cause inflammation. Side effects for antihistamines include drowsiness, sedation, and all of the side effects of our anticholinergic drugs. So our normal anticholinergic side effects are blurry vision, urinary hesitancy, dry mouth, and constipation. Some patients will also experience paradoxic side effects. When you hear the word paradoxic, you are thinking about the opposite. So in this case, we are thinking restless, nervous, and insomnia instead of the expected drowsiness and sedation. We have talked about these in the use of allergic rhinitis and colds. Examples on this slide include first-generation antihistamines and second-generation antihistamine. A first-generation antihistamine would be diphenhydramine, which is Benadryl. First-generation antihistamines typically cause a lot of drowsiness. An example of a second-generation antihistamine would be cetirizine, which is Zyrtec. With second-generation antihistamines, we see less side effects and less drowsiness. However, these second-generation antihistamines are more expensive. Antipyretics. These are used to prevent or reduce fever. An example of this would be acetaminophen. Side effects are rare, and typically we just worry about allergic reactions to the medication. We have talked about antipyretics for treatment of fever with colds and flu. Antivirals. These will help treat the flu if they are taken within the first 48 hours of symptom onset. Examples on this slide all have a common ending of VIR, and the only place we've talked about these medications is for the treatment of the flu. Corticosteroid nasal spray. This will stop inflammatory responses in the nasal area. Side effects are limited to nasal irritation. This patient won't have other systemic side effects because the medication is localized to the nasal area. We have talked about this in the use of treatment of allergic rhinitis, sinusitis, and nasal polyps. There are two types of cough suppressants, antitussives and opioids. Antitussives treat dry coughs by suppressing the cough reflex. They are contraindicated if the patient has a respiratory illness where you wouldn't want to suppress their cough reflex or depress the respiratory system. Examples are benzonatate and dextromethorphan. We talked about these in the treatment of cold symptoms. Opioid cough suppressants will also treat a dry cough by suppressing the cough reflex. They are contraindicated with respiratory depression or with the use of CNS depressant drugs. An example of this is codeine cough syrup. We also talked about this in the treatment of cold symptoms. Decongestants. These are used to treat congestion. These work by shrinking swollen mucous membranes by vasoconstriction of the vessels in the nose. This is an adrenergic agent. Side effects are all related to CNS stimulation. This includes insomnia, increased blood pressure, increased heart rate, and palpitations. Rebound nasocongestion can occur if the patient overuses this medication. And this medication is contraindicated if your patient has high blood pressure, high heart rate, or a known arrhythmia. And all of that makes sense since the side effects include high blood pressure, high heart rate, and arrhythmias. An example of this type of medication is pseudoephedrine, and we talked about this in the treatment of allergic rhinitis, nasal fractures, colds, and sinusitis. Immunotherapy, aka allergy shots. This treats a very specific, unavoidable allergen when the patient is not responding to drug therapy. What happens is that a small amount of the allergen is injected weekly to decrease the patient's sensitivity to the allergen.